this video. In the previous video, I talked about when a patient comes with swelling, what are the things you need to ask to the patient. And after you have taken the history, you proceed to local examination, and that will comprise of inspection, palpation, percussion, and auscultation. So let's discuss about inspection first. What are the things one needs to note down during inspection of a swelling? First, I'll tell you a code. Remember SSPE. So what's that? It's about size, shape, position, and extent of the swelling. When you talk about extent, both in vertical and horizontal dimensions. And this should be described with respect to bony landmarks. Okay, size, shape, I don't think there should be any confusion how to describe the size or shape. Then next, let's come to, then you must describe the color of the swelling, the number of swelling, I mean if it's a single swelling or it's a multiple one, the surface of the swelling. It can be smooth, bosselated, or like a cauliflower growth type, and also the edge of the swelling, whether it's well defined or indistinct. Next is what? You must look for any pressure effects in the swelling, whether the swelling is causing any pressure effect. However, this thing, when I'm talking about pressure effects, this is not one of the initial things that you look. This should be almost after you have carried out everything like size, shape, position, extent, color, number, surface, edge, and also about the surface of the swelling and skin over the swelling. I'd like to add here one more. Let's keep on sixth position. Let's keep the skin over the swelling. I mean appearance of the skin. It can be red, edematous, which points towards inflammatory swelling. It can be tense and glossy, or there can be a scar over the swelling, or there can be pigmentation over the swelling. That's what you need to document here. Talking about the pressure effects, you need to highlight if the swelling is causing any pressure effects, like if there is a swelling in axilla with edema of arm, this must be a lymph node. Then in traumatic swellings, you may find disuse atrophy distally, or you can say wasting of the muscles. That can be due to disuse also, or any nerve injury. Similarly, in neck swellings, you may find distended veins in case of a retrosternal goiter. So that are the things you need to look here. Now, apart from these things, the size, shape, position, extent, color, number, surface, edge, and pressure effects, according to the variation of the position of swelling, you have a few other things that you need to specifically look for. So let me talk about first swellings in the neck. Here you need to look for pulsatility, whether the swelling is pulsatile or not. Now pulsations can be of two types: transmitted pulsation and expansile pulsation. I'll be describing this in the other video when we will be discussing palpation of a swelling. And again, in the swellings in neck, you need to look for movement with protrusion of tongue, and also movement on deglutition. If the swelling moves on deglutition, it can be a thyroid swelling. a thyroglossal cyst, or even pre and paratracheal lymph nodes. Or subhyoid bursitis. And thyroglossal cyst also moves with protrusion of tongue if the swelling is present in abdomen. Look for movement with respiration. This indicates that the swelling is intra-abdominal and arising from the viscera, that can be from liver or spleen or stomach or even hepatic and splenic flexures. And you need to look for peristaltic movements. Like if it's due to obstruction, if the swelling is due to obstruction, as in congenital hypertrophic pyloric stenosis, you may see peristaltic movements. Also, a very important finding that you should not miss on inspection is impulse on cuffing. Or for babies, you can see when the baby cry. So impulse on cuffing should be also seen in inspection. So these are the basic things. Let me first revise it again. It's size, shape, position, extent, the color of the swelling, the number of the swelling, its surface, edge, pressure effects, whether it's causing any pressure effects, and look for pulsatility, movement with protrusion of tongue, movement on deglutition, movement with respiration, peristaltic movements, and impulse on cuffing. So these many things, if you note on inspection, you can very well move ahead to palpation, about which I'll be discussing in the next video.